Well, welcome to our Open Dental Spotlight podcast. This is hopefully going to be the first in many series we're going to be starting here. Today we have what I'm going to call a very interesting and probably not nearly utilized as much as it should be topic, which is going to be eRx, or electronic prescriptions through Open Dental. We have two guests from our eRx department today, which is going to be Kylie and Jamison. So just to kind of break grounds with both of you, Kylie, how long have you, or what do you do here officially at Open Dental?
I am an Advanced Services Assistant Manager, as well as an Electronic Prescription Coordinator.
Keep you pretty busy?
Oh, yeah.
And Jamison, how about you? Same question. What do you do here?
I wear a lot of hats, but mainly an eRx coordinator as well.
eRx coordinator. I find that once you start at Open Dental, you end up donning a bunch of different hats.
You do.
Yeah.
So, as forementioned, today we're going to be talking about eRx inside Open Dental. Not only because we feel it's something that a lot of providers are not using, but it is starting to become something providers are going to need to use in accordance with state laws and changing and things like that. So, right off the bat, things are changing with states that are unavoidable, I'm going to say.
Yep.
So, what are a lot of those changes and what do they mean for the providers?
So we've got a few new states that are going to be requiring controlled substances be sent electronically starting on the 1st of January of 2022. Those three that we know of are California, Maryland, and Utah, but there are plenty of other states who are in the works in their legislature getting those laws passed. For most of the states, that means that the controlled substances cannot be written through a paper prescription. They have to be sent electronically. Another thing that a lot of states are requiring are also the PDMPs, which are the prescription drug monitoring programs.
And what exactly is the PDMP monitoring?
Just drug usage, drug history for patients. So they can tell kind of what they've been using in the past. If they need to be aware of, any usage issues.
Kind of red flags, things like that.
Those sort of things.
It's basically a comprehensive history of every patient's prescription history. So it's got the prescription, how much, who sent it to them, what pharmacy they got it, and they can use that to determine if those drugs are being abused by that patient and whether they should potentially prescribe something else or not prescribe at all.
So basically, because we're finally to a day and time that we're able to create an audit trail for all of these things, as opposed to in the past where it was just all on paper, untrackable, potentially putting patients at risk or exposing them to addiction, or things like that. But now we can track that and make sure that everybody's getting the proper care they deserve, it sounds like.
Exactly.
Awesome. So we know what's coming up with states. We know they're changing. And speaking about the states changing, I know you had mentioned a few that are already going to be going to effect January 1st this next year. Do we have a list available on opendental.com that people can check or that we'll be updating with maybe new states that'll be added to this?
We don't. We try not to advise on laws. We always suggest you go directly to your state and see exactly where they are in the process.
Fair enough. We wouldn't want to be in charge of staying up to date on all those different bills and things going
We
through.
try our best, but,
Understandable.
Definitely don't come to us for legal advice, but we'll try to point you in the right direction.
Fair enough. Well, one thing we can advise on is within Open Dental or what service, I guess, outlet you should be or could use potentially for those electronic prescriptions. I know we have two within Open Dental, one of them being Legacy eRx and the newest being DoseSpot. Can you guys tell me a little bit about those entities?
They're going to accomplish a lot of the same things. At the end of the day, they'll both have that PDMP integration. They'll both have different levels of Open Dental integration as well, but they have Open Dental integration built in there as well. They also do come at different price points. And with those price points do have a few different features between the two. So it really depends on what you're looking for. Some people who have been in the industry for maybe a little bit longer might be more comfortable with the legacy interface. It is also a little bit more cost effective in some cases. Does have some scenarios where there isn't as much integration as there would be for DoseSpot, for example, which DoseSpot does tend to be the preferred option. It does have a more expensive monthly fee, but it does have more open dental integration. It is a little more user friendly. It's more updated. It is that newer thing, kind of like how you mentioned. So they both get the job done, and we always love to go over the pros and cons to make sure people get the right fit for what they need. But it is kind of a pick and choose. They're both going to be able to do mostly what you need to.
So in the end, they're going to do the same things. For the most part, it sounds like there is going to be a little bit of difference as far as the user interface goes. Big point being the cost. And I think something maybe a lot of people don't know, to put it bluntly, we really don't care who you sign up with.
No.
What's
We're
going to
not
be
salesmen.
No.
I've yet to see anybody at Open Dental be in a sales department. So we don't care who you choose. The end result, or what we care about, is going to be A, what's going to be best for you, B, what are you going to feel comfortable using, and C, does it come in at your price point?
Absolutely.
If there's any conflict in there, we're absolutely more than happy to outweigh those options with you and see what is going to ultimately make your practice more successful.
And it's not uncommon for an office to start with one service, realize it's not really for them, and move to another service. That's not the end of the world either. So that's always something that we can assist with as well.
So Jamison, with you saying that, is it safe to say that either Legacy or DoseSpot, these are non-contractual, is that correct?
Correct.
So
Just
you
a
could
month-to-month sort of thing.
so sign up, use it for a month, cancel it or switch, whatever, again, is going to be best for your office. And
Yeah, and the only thing to consider there would be, since the whole conversation is with controlled substances these days, with Legacy, you would want to be aware of some of those additional fees that do come with that, like their EPCS license. That is a yearly license. So that's something where if you were to start with Legacy, for example, pay that EPCS license for a year, that's a non-refundable thing. So that's, there are some caveats there, but as far as, you pay for Legacy, you have it for a year, that's not necessarily how it works. Some of those additional fees will change as far as switching back and forth. You're not going to be able to get refunded for the 8 months you have remaining on your license fee.
so it's like getting into a car accident after you get your oil changed. You're not going to get
Yeah,
that
you're
oil
not going to
changed
get your
back.
oil back.
Okay.
And a lot of that is the vendor itself. That's their fee.
Yeah.
The providers actually pay that directly to the vendor through PayPal during the sign up process. So we don't even get a say in that refund.
So pretty kind of in that segment there, or transitional process, Open Dental is relatively hands off. We'll support you as far as using or errors or whatever outlet you go with, but as far as the payment towards for these services, that's not coming to Open Dental. That is
The monthly support cost for eRx, that comes to us and we ship it directly off to the vendor, so that we do take internally and send it to them, but the extra cost of the controlled substances with Legacy, that goes directly to the vendor.
Yeah, which there isn't any additional fees with DoseSpot. The flat fees that you have with DoseSpot is all there is. So that's another thing to consider.
awesome. So I have a feeling we've already, for the most part, touched on this, but coming into 2022, what are the overall benefits of electronic prescriptions? I mean, we already talked about that we're going the way of the pad of paper, but what other benefits are ultimately going to have with making this transition?
The biggest is going to be the integration with Open Dental itself, with both Legacy and DoseSpot. Once you prescribe something and you go back into Open Dental, those prescriptions are going to be showing in the chart in your Open Dental and give you a clear view of that patient's current medications. You can see any medications they've taken in the past, and
Any medications they've had in the past, any medications they're currently taking. Obviously, you're going to have with some of that PDMP monitoring. You can still have some of that from past paper prescriptions as well. It's just going to make it easier to have everything all in one place, and potentially on the go too. If you're using DoseSpot, then you can utilize some of our additional e-services, like Open Dental Mobile. You can actually prescribe things on the go through the app. Again, that's an additional service on top of just paying for DoseSpot, for example. But those sort of things where you can be in multiple places all at once and have access to all of the same stuff in that database. Whereas pen to pad, you're a little bit more limited in that regard. So there are a lot of really helpful things, and most of it honestly does come through the integration because Open Dental is not DoSpot and Open Dental is not legacy, but Open Dental works with both of those in a way to where no matter where you're at, you're going to be able to kind of see what's going on between the two. And, having that availability in your practice management software to be able to keep tabs on what's going on elsewhere with your prescriptions, I think just makes things a lot easier instead of having to keep track of where's all my papers.
Sure. So moving to the 21st century.
Yeah. It's also just generally more secure when we're sending stuff electronically, which is kind of the whole point with controlled substances and the two-factor authentication. When you're going through and approving and sending those, you're not only using personal pins, but you're also using 6-digit codes through those authentication apps. So Duo Mobile or Authy are the ones available for both of these services. And that's, again, just to ensure that the people that are actually authorized to send these are the ones that are sending those, and nothing nefarious is going on.
And then on top of that, I think you mentioned earlier, it sounds like with all of these checks and pins and things like that, there's also going to be somewhat of an audit trail of what's happened in the past, that if there is any discrepancy or anything like that, we could very easily look at that to determine where something started and why it is where it is now.
Exactly.
Yep, both services have an EPCS audit trail in addition to our audit trail in Open Dental. That'll show exactly when it was created, who created it, who sent it, and to where.
And then just to kind of rewind, you said you had made mention if an office is signed up both with DoSpot specifically and the Open Dental mobile app, again, 2 different services, that they'll be able to send prescriptions through there if doctor's out on the back 9 and not in the office.
Yes.
Fantastic. Well, one thing I did think of, and that is definitely kind of a luxury, if you will, in addition to moving away from these paper prescriptions. Tell me about proxy users. What are they?
So proxy users are just non-provider users. There is some difference in how they can be used between legacy and DoSpot. Essentially, the idea is, again, we know the provider's usually busy throughout the day, understandably so, doing other things. And the proxy user is not necessarily able to send those controlled substances out, or in some cases approve any substance, even if it's non-controlled, but they're able to queue things up, they're able to get things ready, and then when it's ready to go, the provider is able to jump in there, review it, and prescribe it whenever they can, even if it's from the mobile app, as we kind of mentioned there. In legacy, those proxy users actually have the ability to send non-controlled substances. When it comes to controlled substances, it still requires that 2-factor authentication from the provider specifically to actually send those off as a security precaution.
Sure.
That's not an option in DoSpot. They're only able to queue those up. So that is something where, again, depending on what your workflow is and what you're comfortable with in your office, you might want to make that decision there on, do I want that proxy workflow where they can send stuff? Or if I go with DoSpot, they don't have that ability at all, but can still create pending prescriptions. So it kind of improves the workflow in that regard, because anybody that does have access, which by the way, those users don't accrue any sort of fee, anybody that has the permissions and has been set up properly can be a proxy user. But it just gives more people the opportunity to get some of the legwork done, and then the doctor can come in and approve and send whatever's needed.
Yeah, definitely speed things up for busy providers, regardless of their schedule. Kind of queue those up.
Yeah, and in addition to that, with DoSpot, even though the proxies can't actually send those prescriptions, once they queue them up, DoSpot has a feature where inside of Open Dental, when the provider is logged in, the eRx button will have a little alert and tell them how many pending prescriptions they have. When they click on that, it'll take them to a list of all their pending prescriptions to review and send.
So as long as you're paying attention, you should be well aware that you have extra work to do. Nothing should go miss. There's no excuse for it.
Yep.
And that's some of the benefit that you get with DoSpot's integration with Open Dental, where you might not necessarily get that with something that isn't integrated in that fashion.
Those alerts.
Yeah.
Well, that's fantastic. So I did have one question I was kind of dying to ask you guys as I was getting all this ready for us. If we were to have a race, and I'm really just curious, between using DoSpot and writing down a paper prescription, between the two of you, who's going to win?
I think somebody who is using eRx is going to win that foot race. I think you would probably agree with me on that, Kylie.
Definitely more readable, at least.
Yeah. And another key thing that both services offer, which would kind of help with this foot race, is the fact that you can have those favorites lists created, which is specifically going to be for a provider who has maybe a handful of prescriptions that they know they use very often. They can save that prescription with the script filled out and everything, and just have that on a list. And if they know they're going to go in and prescribe X medication, they can just click on it, make sure everything's good to go, and then it's ready to go out the door.
And they can pretty much cater those to whatever they find themselves prescribing a lot, amoxicillin or...
Exactly. And you can obviously edit those, remove those as things change, and add on to it as you find new things that you need to do. But once you have that set up, it's just a couple clicks away.
So almost someone can kind of compare it to us, Open Dental, and say that it sounds very not only user-friendly, but customizable to, again, make these practices successful in what they're doing.
Absolutely.
Well, that's awesome, guys. Anything new coming to eRx? Anything we can be on the lookout for?
Not that I can really think of at the moment. It is, I do think some people still don't even fully realize the capability that DoseSpot has with mobile, and some of the things you can get out of that. That's probably a feature that, aside from just general eRx usage, that most people might not even be aware of. I can't really think of anything else, though, at this point that is going to be at least far different from how it currently is.
Yeah, I don't see a lot of changes coming in the usage of them. One thing that is in the works and should be done soon is the ability to use DoseSpot with our Open Dental Cloud version, which is exciting.
That'll be
At
awesome.
this point, Legacy does not integrate with it, but in our next version, Open Dental Cloud offices will be able to use DoseSpot with the cloud.
Awesome. So I know at this point everybody is probably dying to get more information on these two options. Again, DoseSpot, Legacy. Where would they, I guess, one, go to find more information on either one? And if they decide on one, where would they go to start the process to use it?
So all of our information is on our website, opendental.com. You can just look up eRx and it'll have all of the information on both of our vendors. But I always suggest calling in and discussing with one of our techs what you are really looking for in the usage. Because like we mentioned, there are different functionality points and we want to talk it through with you and help determine what's going to be best for your option or for your office.
So not that any of these things are, again, contractual, but rather than going through a bunch of legwork to find out you've signed up for something that's not going to be right for you and having to backtrack and almost start the process over, call in, have a chat. We've got, at this point, hundreds of technicians that, go through a lot of our eRx classes taught by these fantastic guests we have here today to polish up their knowledge on these services and things to keep an eye out. So give us a call. We'd love to talk to you about it. Again, we have the information available at opendental.com. Do a search for eRx. You'll find that eRx homepage. Well, that's awesome, guys. The one last thing, being in your advanced services role, I'm just curious, have you, being here at Open Dental, we obviously operate out of the beta version of the program, so we're privy to new features that may have not been released in the stable version yet. And I'm just trying to get one of you to slip something here. Anything new and exciting coming to Open Dental that you personally are excited about, even outside of eRx?
I'm really excited about those pre-meds on those reminder texts that we can send to our patients.
What do you mean pre-med? I mean, obviously, we're all familiar with what a pre-medication is, but what's a pre-med on a reminder text?
So basically, you can mark in Open Dental whether a patient needs a pre-med before their appointment, and the pre-med reminder will allow you to remind your patient via text or email to take that medication before they get to their appointment.
So really just built right into the automated message that's going out for the reminder, hey, take your pre-med. And we're going to be able to avoid office staff having to take the time to call that patient to remind them to take their pill at X time and things like that?
Yes, absolutely.
Well, that's fantastic. I imagine that's going to save and expedite things quite a bit. Keep people from forgetting. Well, that's awesome, guys. I appreciate you in both your times. I think this has been very informational, and hopefully, I know it's going to help a lot of our users within Open Dental and make that correct decision. I think that does wrap it up for today's podcast. Again, hopefully, we do plan on putting several more of these out for different subjects as they arise through Open Dental and topic and points of discussion. With that being said, we hope you all have a fantastic rest of your day, and thanks for joining us.